So this model is what you call the health iceberg model. It also is very important in public health because it allows us to look beyond what comes or what is actually visible. Okay, so what is it? How is it useful? And how do we use it in public health? These are things that we are going to look at here. So an iceberg is when you look at a water body, you can have a very ice, big ice, okay? And then on the surface of the water, you see just a small part of this ice up here. Yet down here, you have the ice actually being very big. Yeah? You can see it is very big. So what this model tells us is that the things that we see, um, the people that we interact with at our health facilities, or when we have campaigns for, let us say, screening, the people that come, they're a small part of what is happening in the community. A small part of what is happening in the community. So usually, there are many things that are happening in the community that are resulting into this state of health that we are seeing. Okay, so if you have, let us say, 10 patients coming to the NECD or chronic care, the chronic care clinic, what you should ask yourself, if we have 10, how many do we have in the community? Usually, most cases, definitely there are very many in the community, in the communities that you have people who are having that condition. In this case, let us use hypertension. If you have 10 hypertensive patients coming to the hypertensive clinic, there are very many of these people who are in the community that have not come. So what we usually see are very few individuals. Now, if you don't look at it that way, you can also look at it in following this aspect or this understanding that the people who come with to the hypertensive clinic, you have very many factors that are contributing to this state of health, which is, in this case, we are using hypertension. Very many factors are contributing, and these factors, you cannot see them because you're only interacting with patients up here. So until you go to the communities and understand all these factors that are contributing to this state of health, you will not understand the issue quite well. Okay, so that is the iceberg, that the part that is visible is very small compared to the extent of the problem that we actually have. Majority of the mass of the iceberg is actually underneath. So most of the things that contribute to this state of health, we cannot see them immediately. For us, we only treat, if you use the clinical approach or the biomedical approach, we only treat the person who has come with hypertension. But when we dig further, you will find out that there are very many factors that are contributing to this hypertension. So that is the iceberg model. So it emphasizes that don't only focus on what you see, you need to deal with the invisible contributors to the problem that you are seeing. Okay, so to break it further again, the part that you are seeing is usually, these are usually the patients who are having particular conditions or the health problems that are identifiable. And these are usually, yes, please. These are usually with, these are usually the cases that we see in our health facilities or when we go for screening. Okay. And then the ones that we don't see are the factors that are contributing to the ones to the state of health that we actually see. So some of these are immediate factors, some of these uh, are intermediate. Okay. So you have intermediate factors, and then these intermediate factors are the ones that contribute to the immediate factors, and the immediate factors now contribute to the health outcome that we are talking about.